Hello, we are learning about antiplatelets today, like aspirin, ticagrelor, calabidiol, and diprimidol. Antiplatelets are mainly used for the prevention of clot or thrombus formation on the arterial side of the blood, whereas anticoagulants like warfarin are used for conditions like the prevention of deep vein thrombosis or pulmonary embolism. For conditions like stroke or coronary artery atherosclerosis, mainly due to platelet activation and aggregation. These drugs are very effective in preventing the rupture of atherosclerotic plugs on the arterial side of the blood. So, if you remember from physiology, when platelets are circulating in the blood, they are not activated. They're in this small shape, circular shape. And the endothelial cells produce prostacyclins, which prevent them being activated. But when there's a vessel injury, platelets are activated by many factors like von Willebrand factor, which released by both endothelial cells and activated platelets. Adenosine diphosphate, which also released by platelet activated platelets. Thromboxane A2, also exposed collagen and thrombin as well. So all these factors activate the platelet and also amplify the signal, making the platelet change shape and then um, make a platelet plug, basically stopping the blood, but then also the risk of causing the closure of arterial blood supply, say to the heart, in the case of causing myocardial infarction, and the pathology of stroke, especially the ischemic stroke. So, what this causes is if you activated one platelet, it releases all these factors like von Willebrand factor, the ADB, the THA2 are all released by the platelets. They change shape, they stick to each other, and then they form this plug. So, what we need is if we stop any of these factors, then we can stop or at least delay the formation of clots in the arterial side of the blood. So, calabidiol and aspirin are used to block, especially aspirin is used to the inhibition of cyclooxygenase from the production of TH2 or thromboxane A2. It irreversibly inhibits this enzyme, resulting in um, the inability of activated platelets to release THA2, and also reducing the aggregation of platelets because they can't um, stick to each other because of the lack of this factor. And also calabidiol and prasugrel and ticagrelor block the action of adenosine diphosphate from binding to the platelet and then activating the platelet and increasing the signal. So these are used mainly in the prevention of peripheral arterial diseases like Raynaud syndrome or claudication, the prevention of angina, prevention of stroke, prevention of myocardial infarction, and atrial fibrillation as well if warfarin can't be used. These could be you could use this shortcut called PASMA to remember the indication is for antiplatelets. And the typical doses are aspirins used 75 milligram daily. It's usually for life if someone had a myocardial infarction or non-ST elevated myocardial infarction. They use it for life. Calabidiol as well. They use double dose calabidiol and aspirin, but the guidelines differ, so you need to check with them. Ticagrelor is also used 90 milligram BD, prasugrel 10 milligram or 5 milligram. depending on the demography, because you use 5 milligram usually for the elderly, and dipyridinol as well, 200 milligram twice daily. So cautions for all antiplatelets bleeding, because remember they block the activation of platelets and the aggregation of platelets, so you run the risk of bleeding to death, especially GI bleeding, people with ulcer. And if you use double dose antiplatelet or antiplatelet with anticoagulant like warfarin or heparin, also using selective serotonin reuptake inhibitors for depression, and anticoagulant treatment, all of them cause dyspepsia or indigestion. So you might need to use proton pump inhibitors with antiplatelets. Um, it also, you need to be very careful with using aspirin in people with asthma, because it causes bronchospasm and fatality. It's also contraindicated with people with hypersensitivity to aspirin, people under 16 because of the risk of Ray's syndrome, bleeding disorders like hemophilia, or if someone has very low platelet count. Also, using of methotrexate with aspirin is risk of kidney disease. You might use, as we said, proton pump inhibitors like omeprazole or lansoprazole, and also you could advise patients to take after food to reduce the risk of um, dyspepsia and ulceration. For clopidogrel, prasugrel, and ticagrelor, just remember P. They are contraindicated in pregnancy and hepatic failure, and obviously people who are bleeding or actively bleeding, like people who have a duodenal ulcer, or people who've injured themselves, or people who are going in surgery. So those are all contraindicated. The red flags for antiplatelets, you could use this acronym: bad vow. So basically, people who are bleeding, people on the age over 55 years old and present with symptoms of dyspepsia, um, also dysphagia, vomiting, especially persistent vomiting, anemia, and unintentional weight loss, because that's a red flag for using antiplatelets. So people will need to go for endoscopy to make sure they don't have a duodenal ulcer. Also, pain on palpitation, so they need to have an endoscopy as well. So if someone presents with all these symptoms, they need to be checked out that there's nothing serious underlying the condition. Um, when it comes to drug interaction, it's simple. Remember, if a drug causes or interferes with the anticoagulation or the thrombus formation, it runs the risk of prolonging the bleeding time. So, obviously, NSAIDs like ibuprofen, ketoprofen, diclofenac, all of them um, increase the bleeding time. Selective serotonin reuptake inhibitors, also venlafaxine and duloxetine. These are serotonin norepinephrine reuptake inhibitors. Also anticoagulants like warfarin or acetoconomor, heparin, low molecular weight heparins, corticosteroids like prednisolone or dexamethasone. Nicorandil, which also used in angina, is a potassium channel activator and cause a risk of ulceration. So if you use with antiplatelets, you run the risk of increasing ulceration. Also, remember, clopidogrel is a prodrug, so it needs hepatic activation. It's activated by the CYP 450 enzyme. So some drugs like omeprazole or esomeprazole or fluoxetine block this enzyme. So clopidogrel might not be converted to the active metabolite that block the ADP receptor. So you might lose the antiplatelet effect. So you need to avoid using clopidogrel with omeprazole and esomeprazole. So you might use aspirin, um, oticagrelor, or other antiplatelets. Also, people on aspirin, on low dose aspirin like 75 milligram, they'll usually buy ibuprofen over the counter or from shops. But remember, ibuprofen is an NSAID, so it competitively inhibits the COX enzymes, which aspirin also binds to irreversibly inhibit. So if you give, say, 200 milligram ibuprofen, ibuprofen might be ibuprofen might bind to the receptor, so aspirin has no chance of binding and irreversibly inhibiting the cyclooxygenase. So you might lose the antiplatelet effect of aspirin. Um, so also increasing the risk of duodenal ulcer and dyspepsia. So you might need to avoid using unless it's needed. Or for occasional use. Also remember, ticagrelor is a CYP3A4 substrate, so it could be its concentration in the blood could be increased, reduced, or itself could increase or decrease the CYP3A4 substrates like simvastatin, clarithromycin, ritonavir, rifampicin, ketoconazole, and as well. So if you remember that ticagrelor is CYP3A4, remember CYP3A4 enzyme is a substrate for 50% of medicines are substrates for this enzyme. So um, if you use a drug that blocks or induces the enzyme, so the concentration of ticagrelor might be increased or reduced depending on the substrate.